Hello, my name is Fred Trotter, and I am a healthcare data journalist with CareSet. Today, I'm actually recording this podcast from the CareSet offices in Houston, Texas. So that's a little bit of fun for me. And we are working with Datapalooza to do a series on the speakers of Datapalooza 2024 and to kind of rebroadcast some of the things that happened at Datapalooza. And one of the most exciting things that happened at this year's Datapalooza is that we heard from the Joint Commission. And I'm really excited. I was not able to hear the session, so I don't actually know what the session was at Datapalooza exactly, but I wanted to give the opportunity for Kathryn Spates, who is the Executive Vice President for Public Policy and Government Relations. And we have a link that we'll put in the show notes for your jointcommission.org profile page, which talks about you've been involved in clinical, legal, and government relations stuff for more than 25 years. A very impressive resume. But I'd like to just kind of open the floor to you and say, what brought you to Healthcare Datapalooza?
Sure. Yeah. Thank you so much for the question. And before I begin, I do just want to highlight, because it's not always, people may not really understand or know the work that the Joint Commission does. So the Joint Commission is an accreditation organization, and we accredit healthcare organizations are really across the continuum of care. We work with hospitals, we work in the ambulatory setting space, the nursing care space as well. I really say any setting, you name it, we're there. So really have a broad reach in the healthcare delivery space. And we came to healthcare Datapalooza to really talk about the value of data and how healthcare organizations have tons of data that really can be utilized for greater good, such as quality improvement, research, algorithm development, which is really important now when you're hearing, which is such a hot topic right now with AI, and making sure that data that we put into algorithm development is good data. And so like I said, there's really great value in data that the healthcare organizations have. And we really came to Datapalooza just to talk about that data.
Yeah, and I mean, I think you're absolutely right. A lot of people don't understand what the Joint Commission does, and also just don't understand the role of accreditation in this country and how it has changed over the years. There's a seminal IOM report called To Err is Human that I think is 1999, if I recall correctly.
Yeah.
And since that time, there has been a focus on quality and a focus on patient safety in the industry that has borne incredible fruit. And one of the incredible factors that has dramatically impacted that movement as a whole is accreditation. And then within the accreditation space, the Joint Commission has been a consistent leader.
Exactly.
With that in mind, and sometimes you can't toot your own horn to that degree, but I do want the patient listeners to understand the things the Joint Commission does has dramatic impact day to day on ensuring that patients are safe in hospitals and the other facilities that you mentioned. And the way in which you leverage data to do that is something that, if you are a patient who's interested in data and or someone who's interested in data rights and how data impacts patients, is really something important to pay attention to. With that in mind, what healthcare data sets are you interested in that you specifically care about for your work?
Yeah, so what we came to Datapalooza to really talk about is the value of data, but specifically around de-identified data. And that's really the data set that we came to talk about. And we were really hearing from a lot of healthcare organizations that they want to be able to utilize data, and specifically de-identified data, and they were really looking for a framework and really a third party to develop a gold standard resource, if you will, so they could be evaluated to ensure that they're using best practices, but also to test their processes on how they're handling health data. So that is really the data set that we came to talk about, is de-identified data. And what we also talked about is that the Joint Commission, again, I highlighted that we were really hearing from healthcare organizations that they wanted a framework. So what we created was a certification. This is not our traditional accreditation program that's a requirement for healthcare organizations if they're going to participate in Medicare. This is a voluntary certification called Responsible Use of Health Data Certification. And it really provides that objective evaluation that we were hearing that healthcare organizations wanted, and that framework. This certification was based on principles that were adopted by the Health Evolution Forum that's called the Trusted Framework for Accelerating Responsible Use of Use of De-Identified Data in Algorithm and Product Development. So we took this framework and we created a certification, and it addresses a lot of the elements that we were hearing from healthcare organizations. They were wanting best practices on de-identification. They were wanting really a framework on data control, limitations on use, and an oversight structure such as a governance structure. And then also, what are best practices on what should be communicated to the patient? How do we ensure patient transparency around data practices? And then also the certification also addresses algorithm validation and really addressing some of the biases that we do see in data, and specifically around de-identified data.
Thank you. I did some quick Googling while you were talking, and I did find 2 links. One to, I think, the certification, responsible use of health data certification, and the other for the kind of paradigm itself, which the certification is based on. And we will add those to the show notes, which means when people are watching this on YouTube, if you'll just scroll down and click, you'll be able to find those 2 roles. And my initial read on these web pages is they're very much worth reading. So you should definitely go check those out.
I will just highlight to you is, what's really critical and what we were hearing, for healthcare organizations is there's a gap in regulation. There isn't at all a framework or regulation that addresses de-identified data. And then for data use for secondary purposes, so outside of that clinical care. And this is where we feel this certification really can help fill that regulatory gap.
And just to be kind of further, yes, and the governing document for clinical data that's gathered by healthcare providers in the United States is HIPAA. There are European things that actually would address this gap if they were in the United States, called I think GDP, and I can't remember what that stands for, but it doesn't matter. We'll put that in the show notes too. We'll put a link into the show notes. But it is of great note that there is no such equivalent law in the United States. HIPAA does kind of create a knife that says, here's what's going to be the rules for working with identified data. And then once it is de-identified, then it is essentially under HIPAA safe to publish, and there are no further constraints. And that void of no further constraints is precisely the one that the Joint Commission is proposing to fill.
Exactly.
We will add the, I think if I, and I first of all, let me thank Alma Trotter, my sister, who helps me produce these things. When I say we're going to add it to the show notes, I mean her. And so this is going to be a little bit more work than normal, but Alma, if you don't mind, would you please add to the show notes the HIPAA de-identification rules and the HIPAA safe harbor rules, which I think if our listeners want to read more about that, they can do that. You have covered a lot of ground. Is there anything else you would like to talk about?
No, again, that's, really the reason why we came to Datapalooza, because there is value in data, and we really want healthcare organizations to be able to utilize de-identified data for secondary purposes. Really what's really important for the Joint Commission is around quality improvement. And we know there's significant value also in algorithm development for AI, but at the same time, there needs to be, appropriate guardrails in place to making sure that the de-identified data and the use of it for secondary purposes, it's appropriately used and not misused. And we really think this responsible use of health data certification creates that nice balance and nice framework for healthcare organizations.
Thank you for working on quality in healthcare in the United States. It's really hard to talk about the value of that kind of work. I was crossing the street, and I do walks every day, and I crossed the crosswalk person, the guard there, and I said, "Thank you very much. I really appreciate you doing this." And a person might sit in that crosswalk for 10 years and might have, 20 or 30 near miss incidents where they stop a car from hitting a kid. And none of those kids are going to remember that, but they're going to go on to be grandparents themselves. So that the value of people who make sure that terrible things don't happen to people is very hard to recognize. And sometimes the people who work in the crosswalks feel like they're not spending their time well and everything else, and people tend to take them for granted. I do not make that mistake. So I'd really like to thank you for your work.
Well, thank you. And thank you for the work that you do to help share all the work that we're doing. So we greatly appreciate it.
You are certainly welcome. Thank you for giving me your time today.
Yep. Thank you so much.
All right. Bye-bye.
Bye.